For today's presentation, we're going to be going over non-communicable diseases and mental health disorders. First off, non-communicable diseases are chronic diseases that cannot be passed from person to person. They usually have a lifetime duration, and they come from a combo of genetic, psychological, environmental, and behavioral factors. For an overview of non-communicable diseases, the most common in low to middle income countries include cardiovascular diseases, chronic pulmonary diseases, diabetes, cancers, musculoskeletal diseases, and mental health disorders. The burden of non-communicable diseases is higher than communicable diseases in low to middle income countries, with sub-Saharan Africa as an exception. Burdens will increase as economic development increases, and risk factors in many diseases directly relate to lifestyle factors which are modifiable. First off, cardiovascular disease could be broken into two main diseases. First off, being ischemic heart disease, which is the fifth leading cause of death in low to middle income countries and the leading cause in middle to high income countries. We also have stroke, which is the second leading cause of in middle income countries and the eighth leading cause in low income countries. And for risk factors, there are genetic risk factors such as men being at higher risk than women, a significant family history, and aging can increase your risk, and modifiable factors such as hypertension, tobacco use, high cholesterol levels, lack of physical activity, and excessive alcohol consumption. Next, for diabetes, there are three types. First off, we have type 1 diabetes, where the pancreas does not produce insulin. Genetic risk is a factor. There's some environmental factors, and aging can be a factor, but it is still highly unknown what exactly causes type 1 diabetes. For type 2 diabetes, the pancreas does not produce sufficient amount of insulin or body does not use it effectively. There is a genetic risk. Poor diet puts you at a greater risk, lack of physical activity, and increased age. And gestational diabetes, which is decreased insulin sensitivity due to a placenta. So this happens during pregnancy, but it resolves after pregnancy with an increased risk for type 2 diabetes. It is the 14th leading cause of death in low income and the ninth in middle income countries. And there's lots of important and expensive complications in diabetes, like emergency hospitalizations for hypoglycemia and daily insulin and etc. For chronic pulmonary diseases, the main one that we look at is chronic obstructive pulmonary disease, which is COPD for short. Lung diseases it is a lung disease causing limitations in airflow made up by chronic bronchitis and emphysema. And some signs that people exhibit are shortness of breath, excessive sputum production, and a chronic cough. The main risk factors include tobacco smoke, including secondhand smoke, household air pollutants, cleaners, occupational exposure to dust and chemicals, and frequent respiratory infections as a child. 90% of all deaths in 2016 came from COPD occurred in low to middle income countries, and it is the 14th leading cause of death in low income countries and the fourth leading cause of death in middle income countries. For cancers, it is a unique challenge because of the many forms of cancers, the risk factors associated with different types of cancers, the treatments, if it's preventable or not. And the burden continues to grow as people live longer, and the burden on communicable diseases goes down, basically meaning that people living longer just gives them an increased risk for these cell mutations to happen, and etc. Some risk factors can be based on environmental factors, genetic factors, the standard of living that people have, tobacco use, poor diet, and sedentary lifestyle. Again, there's a broad range. Like I said earlier, it's a unique challenge because there's many different forms of cancer. And although cancer prevalence is increasing, there's a difference in low to middle income or in high income mortality rates, obviously because of access to treatment, the ability to afford treatment, and the knowledge, the education that people have in higher income countries as compared to lower middle income countries. For mental disorders, just in general, mental health disorders includes depressive disorders, eating disorders, anxiety, bipolar disorders, attention disorders like ADHD or ADD, conduct disorders, disorders relating to the autism spectrum, developmental disorders, and substance use and abuse. And the four disorders that contribute most to the burden of health are anxiety, bipolar, depression, and schizophrenia. Some risk factors for mental disorders are genetic, environmental, lifestyle, and substance abuse, and usually it's a combination of one or multiple. And these disorders account for 5.4% of all deaths in 14 to 49-year-olds in low to middle income countries. And these disorders are often disabling because of the long duration, the lack of cure, and their young age of onset. Um, And just to talk about the two major risk factors for non communicable diseases would be tobacco, which is the third leading risk factor for death of all ages and income statuses. And the more educated people and people of higher socioeconomic classes are less likely to smoke. And most common tobacco related deaths are from cardiovascular diseases, pulmonary diseases, and cancers. And another risk factor is alcohol, which is the ninth leading risk factor to health globally among middle income countries. And it increases risk for hypertension, liver and pancreas damage, hormonal issues, heart disease, as well as accidents, injuries, and lifestyle risks. And some consequences of non-communicable diseases is obviously an increase in cost. So the cost of treatment and prevention of these diseases will increase as low and middle income countries advance the economic status, meaning that as these countries become richer, they'll start to have a more higher prevalence of non-communicable diseases than they will of communicable diseases, meaning that the treatment and the prevention of these diseases will have to be funded heavier to account for that increase in number. And non-communicable diseases are the largest cause of death globally, and they're responsible for more than 3 of 5 deaths each year globally. And non-communicable diseases create poverty by hindering economic advancement, meaning that these diseases are disabling, so people are less are able to less able to work and fund this fund these economic advancements and try to progress from low to middle and middle to high income statuses. And addressing the burden of non-communicable diseases, attention needs to be given to these diseases because of the rising prevalence in low and middle income countries. So even as we're advancing, even though in low income countries they can't eat, say these high fat foods and all of this, have this lifestyle all the time. There's still a rising prevalence, just because of these modifiable risk factors such as tobacco, alcohol, dietary risks, and sedentary lifestyle. So, and there needs to be increased funding for prevention and increased funding for treatment. And there needs to be an increase in educational information and awareness towards modifiable risk factors, like we see in high income countries here, like the Surgeon General warning on a pack of cigarettes, for example, or the nutritional value label on all food that was passed by the FDA, or things like these that can go and modify these lifestyle risks that are putting so many low and middle income countries at a higher risk for obtaining these non-communicable diseases and not being able to fully economically advance into middle and high income status. Thank you.